Great. So I'll just do a quick introduction to the purpose of this meeting. And because we have such great turnout, it's really exciting. I think instead of going around and introducing verbally, if everybody can pop their name, organization, excuse me, into the chat, I think that would be great and most efficient. And also I want to let you all know, I think you know when you logged on that you had to accept that we are recording this. And the reason we're doing it is so it can be shared with those who weren't able to make the meeting. And then also we want to make sure, you know, if you internally within your organization would like to share the information with others at a later date, you certainly can do that. So with that, and thank you, it looks like people are starting to put their name and their organization in the chat. Great. I will just start with letting you know that the purpose of this info meeting is to provide you more background and an overview and a little bit of the details of the CDPH program and the Primary Health. It's a partnership between CDPH and Primary Health to help CBOs conduct Binax testing, the rapid testing on site, so we can make that more available in our communities. And in order to provide that background, we have Dr. Duncan here, and she is going to share all that she knows, which is quite a lot, quite a lot and more about this program. And then we will have a few of our community partners who have already started the process, or in fact, I see one person who is in fact already been through the full training and is conducting the test. They can share a little bit of their insights, and then we'll have Q&A. If you'd like to ask questions in the chat, of course you can do that as well. So with that, I am going to hand it over to you. Dr. Duncan, are you ready?
Yep, I'm ready. Hi, everyone.
Great. Thank you.
Thank you. Thank you so much for joining us. Really, really excited about this initiative that we're bringing across the county. We want to make it, we really want to enable you to feel very comfortable with making the choice as to whether or not you want to proceed with the program, and to understand very clearly how we're going to support you to do this. Because our feeling is that you're joining into a partnership with the state in order to provide testing, but it's really a very county-based grassroots effort to make COVID testing, and in particular rapid COVID testing, available for our most vulnerable populations, and also in resource scarce settings, and just generally more available to the public if we can. But we're very, very excited about working with the community-based organizations that are working with our special populations and providing such amazing partnership and service all the way through the pandemic, really. And I know you guys have been working with Kathy Kublik and Lisa Santora, and at times myself and others to engage and be proactive about education in your settings and about providing resources and information. And we are just humbly and deeply grateful to all of you for your ongoing leadership. So this is a big ask. I mean, I think it's very exciting and empowering for us to be able to help you to become testing sites for your employees, for your staff, and for your populations. And we want to help you to do that, but we want you to feel really comfortable and confident. So I am going to go through a lot of stuff today, and I've just realized that there's no possible way I can cover everything I want to cover. So I've already titled this webinar number 1. All right. So just so you know, this is webinar number 1 of the first of a series of webinars that we will jointly hold with my testing team and the CBO organization and all the liaisons led by Randy and Patty, whom you are getting to know well, or already know well in many cases, in order to answer all of your questions as we go along. So our agenda for today is to identify the objectives of community-based testing. That's number 1.
Dr. Duncan, are you sharing your screen?
No, not yet, but I will be.
Oh, I thought that you were referring to a slide. So sorry. Okay.
No, no, I didn't put the agenda on a slide because I was making the slides until 10 seconds ago and they're not finished. So that's why this is webinar number 1. So we're going to identify what is the role of community-based testing for the county. We'll discover that through our discussion and sharing. And we will also, I'm going to get into a little bit of the nitty-gritty about how the application process goes, because we want you, if you're at all interested or you think you might proceed, we want to start moving you through that application process. Now, I know some of you are at various time points in that process already. You may have submitted the application. You may be in the MOU phase. You may be starting the training. Each of you is probably experiencing a set of different questions, barriers, challenges as you go through that process. We are going to be, from this point forward, more available to answer your questions and to provide support in this area. So today, I'm going to start with just going over what the application process looks like up to the point of getting the MOU, and try to answer as many of those questions as I can so that you can whip that out slowly and carefully, but whip it out if you want to proceed with the process and get ready to become a community testing site or an entity that is able to provide testing to a specific group of people, whichever way that you want to think about it. So I am going to start sharing my screen now. So let me do that. Okay, so I'm going to ask Randy if she can see the slides well enough.
Yeah, I can see them.
Okay, so let me just, there we go. Okay, I hope everyone can read that pretty well. All right, so here we are. It's webinar number 1, as I mentioned. So who's invited? Here are community-based organizations, other nonprofit organizations, and some specific employers are going to be learning about providing on-site community-based testing. What are the benefits? Well, for some organizations, it's going to be a requirement for compliance if they fall under one of the currently active public health officer orders that require certain employers to verify vaccination and or routine testing for those that are unvaccinated. So it may be a pathway for you to provide on-site testing for your employees. However, I think most of you are going to be down here, bullet point number 3, sort of maintaining a safe work environment and as a service to your community. Or your clients. Don't worry, I won't be making all the slides as we go along. So in thinking about how you do this today, this is what I would like to cover really is how do you submit the application up to the point where you sign the memorandum of understanding between your entity, your organization, and the state of California Department of Public Health. That is who is in that MOU. It's your community-based organization with California Department of Public Health, and also the primary platform. So what happens after you sign the MOU is that you sit around and you wait for just a day or two. And then if you don't receive an email introduction from the primary health system, then you're going to either reach out to them or reach out to us so I can check on the progress of your application through our contacts at CDPH. Once you get that email, that means that they are ready to open an account for you. And at that point, you will have access to an online portal. This is what will be more of what we'll be going over in the next webinar. You'll have access to an online portal where you will be able to set up your account, determine who your leaders and administrators are going to be for managing that account and the information. And then you will also, once that is done, you will be able to go through the training and certification process. So we'll talk about each of these things. if you'll get a copy of this PDF after I clean it up. So no worries about that. I'm going to show you a series of web pages and links because I want to do some clarifying. When you start to explore this process, you're going to find that there are a lot of sort of redundant and layered web pages at the state or with primary, and they all pathways sort of generally eventually lead to the same place, but it's fairly confusing, I think, as to which is the best landing page to start this process. So if you happen to find yourself on the page that's titled Starting a Testing Site in Your Community, you're going to get this page, which this is the top of the page, and this is sort of the bottom of the page. And it's going to be an introduction to an overview of the process and a couple of short videos about being a partner with the Primary Health platform and doing on-site testing. So this is a learning and introductory resource page. Other resources that you may find helpful that will provide an overview before you start your application process include this FAQ sheet about the process of the application, which is available at this link here, which is going to be a live link in your PDF. Other deep dive resources include this Antigen Testing Playbook, which you should have on hand when you are at least at the MOU stage of your process and getting ready to start your training. However, I do want to provide a cautionary note that this is an extremely detailed and complex playbook. I think that for those who don't regularly provide healthcare or laboratory testing and are not familiar with some of the language that's used in that space, it may seem overwhelming when you're thinking, gosh, all we wanted to do was provide a few Binax tests for our clients at the food bank. And then you start to read this 49-page playbook and you can feel like, wow, what am I getting myself into? So what I want to say to you is please don't be overwhelmed or intimidated by this particular playbook experience. We are going to be supporting you to learn how to do this, to do it safely, and to feel very confident and comfortable. So when you enroll in the program, you may be clicking this link, which is I've left here on its own slide so that you know this is a main link you can click to get right to the application process. That takes you to this page where you're going to see an introduction, state of California, and since you are not a school, I assume none of you are schools, so you're going to click the other box, which says other organizations. And I have been putting these yellow arrows in a little bit to help you know right away which entity you are. Once you click that box, or if you happen to land on this page where you see the spirally ribbon, you're going to be clicking the start the application. Okay, and I've indicated that over here. So this ribbon that you see is really the symbol of what we are doing today. You're in this phase right here. You're learning more about the process and you're learning about the application process. And as we move through the next 10 days or 2 weeks with our series of webinars, which are going to be determined by and jointly set up by myself and Randy and Patty, we are going to be progressing through the preparation for testing. Some sites are going to be receiving their test kits, and then eventually, as kits become available and people complete their training, sites will become open for testing. So if you happen to be on this page, once again, if you're ready to start the application process, you're going to be clicking that button. If you want to look at more resources before you do that, then you're going to be going to the resource page, which on any of these pages there's a resource option down here at the bottom or somewhere. And that may take you to this basic resource page. Once you're on this resource page, if you're seeing these gray box choices, you want to make sure that you're on the antigen, that the antigen box is in blue. So you'll want to click that to make sure that the antigen box is in blue, and then you will get the right choices of the drop-down menus. And I'll be coming back to this resource page in a few minutes. Before you embark upon your application, I want to clarify for you that in the application process, you will be requested to choose from a drop-down menu as to what IT platform you're going to be using. You are going to choose Primary Health for this application process. All right. CalReady is a public health and acute care hospital and skilled nursing type of setting database that you don't need to worry about right now. What the Primary Health IT platform is going to do for you, it's going to properly feed all of your test results as required into the CalReady database. All right. I'm going to come back and talk about Navica more later on another webinar. I think there may be some applications for this platform. It is something we can add on later if it is of interest to any of our organizations, okay? So if you happen to click on the box that says, I'd like more information about Navica, you're gonna find your way to various information about Navica. If you would like to explore that option now, that's fine. It doesn't apply immediately for us in these group settings. However, I will address questions on Navica on a later webinar. So for our purposes, for the community-based organizations in this application process, you'll be choosing Primary Health. If you end up on a page that looks like this, you are applying for antigen testing. So you'll be clicking this option, which is right here, and I'll even stick an arrow in there and make it go the right direction to show you which box you click. How about that? If you end up on this page, then once again, you'll be clicking the antigen box. And here it says choose antigen plus confirmatory PCR because in fact, that is what you'll be doing. So you'll see there's this page and this page and also this page and this page and even this page that will eventually help you to get your way to this page where it actually says application. And then the first question again is going to be, are you an organization or a school? Is your organization a school or school district? And we are anticipating that your answer in this box will be no.
So Lael,
Yes.
I'm going to pause. There was a question. There's somebody that question came up. Laura Gonzalez asked if they are from a school, is the process different? And I wanted to pose that now because perhaps maybe sitting through the webinar, this session doesn't make sense if you're a school, or does it still make sense?
I think it may not make sense. So if you are a school under a school district, under one of the County of Marin school districts, then this process may not be for you because this is the process that your district will be doing, we hope, at the district level to then provide account access for each individual school separately, site by site. And that is a program similar to this, which uses the Primary Health platform, but it is different in schools. So I am going to follow up with that individual.
Yeah, I wanted to say that I think it might be a nonprofit at a school. Right? Is that right? Rosa?
Yes, it is.
So that's a little different. So just FYI.
Okay, so if you have special questions like that, let's definitely take those in the Q&A session, because in order to participate on the whole schools program side, I think that's really a very specific entity. If you're a nonprofit based at a school, that's going to be different, and you may want to continue with this webinar. All right, so on page 2 of the application, you'll be putting in your organization name. We hope at this point that you have determined who in your organization will be the lead for operationalizing this testing program. That is the person whose name and work email address and cell phone number should go in this section. So that is important because once you're in the primary platform, the primary health platform with an account, your email and your cell phone become important for logging onto your portal. So you wouldn't want to put your organization's name and your director of HR and then the community service liaison email address and then the phone number of the person who's going to do the swabbing. You don't want to do that. You want this to be one person, one point of contact. Now, this person may not become one of your actual testers who is going to be using the swabs and doing the testing. This person can be merely in an administrative role, but would have oversight over this application and the initial MOU process, and would be the one helping to set up the account with Primary. And once that is done, other individual team members can be identified, and those persons may be testers, or they may be just managing test results, and they will be given access and the opportunity to train in the platform. Does that make sense to everyone?
Yes.
Okay, hearing no questions about that. Next, I want to look at this checkbox here that I've put the arrow to, and it says, check this box if you are submitting application on behalf of another organization or you're within a larger umbrella that's going to be providing testing at multiple different sites. If you think that's where you're fitting in, please just give us a call so we can talk briefly about that and make sure that you're on track to get that account set up properly. I just want to get you teed up in the right direction for the best setup. If you're a single entity CBO that may be testing at various different sites, that is okay. You don't need to check this box. Because as a testing entity, you're able to open up testing clinics, we call them, at different specific locations in time, and that will work out fine. This particular checkbox is if you are a larger organization with multiple smaller entities underneath you, each of which are going to become sort of separate siloed testing entities. And if you think you fit into that category, again, please just give us a call or follow up after the webinar, and we will try to help you sort that out. Down here on this next section, what population will be tested? Generally, most of you are going to be checking the general public box. If you know that you're going to be heavily involved in very young pediatric populations, you would be checking that box. But again, if you're checking participants 0 to 4 years, can you please contact our office so we can provide you with specific guidance? But I think for most of you, you're going to be working with the general public at least age 12 and above, or age 10 and above, or 6 and above, what have you. All right. So then the next section I want to review is how many people you're going to be testing. They will be asking you to estimate that. If you think you're going to be testing more than 10 persons per day, I do have the advice in here, call our office. I just want to be sure that you anticipate the workload that may entail and that you're properly staffed and supported for that. That would require, obviously, more messaging. It indicates to me that you're in a very busy location with a lot going on and you're anticipating serving a lot of people. That is something that where the county would want to be aware of it, and we would want to be supporting that process very closely. So we'd like to have you close on our radar if you think you're testing more than 10 persons per day. Just a way to gauge sort of the busyness of your testing program. Most of you, I imagine you're testing anywhere from 2 to 5 people a day, many days, maybe 0 persons per day. Some days, maybe 1 day a week, you'll be doing 10 or 20 people, but it will be a planned activity. Those are the different varieties of types of testing amounts that we are envisioning, but we would like to also understand what you are envisioning as you are getting ready to do this. For the frequency, which they will be asking you to indicate how what frequency you're going to be testing, it not too heavy of a requirement here. I would just recommend that it's going to give you a drop-down menu. It's okay to just put 1 time per week per state health officer orders. If you want to choose a different amount, you can. I'm not sure that at this point we have much insight into what kind of testing is going to be required for frequency, but in general, if you're testing an individual, it's going to be 1 or 2 times per week, probably, and with guidance from County and Marin Public Health, probably from my office or through your liaison who's working with Patty and Randy Lecter. So we want to be sure that you're staffed properly and adequately for the amount of work that you're going to be doing. If you're just doing a couple of employees or small groups of students here and there, I think minimum would be to have 2 people who are deeply and wisely trained to use this system and to do all of the testing and required reporting through the IT platform. If you anticipate large testing events where you're going to be testing 20, 40 or more people per day, you may want to anticipate that you'll need to cross-train other individuals. They don't all have to know everything about everything. People can be assigned certain tasks. Certain people can manage the swabbing. Certain people can manage the actual reagent and test cards. Certain people can be managing the IT platform and the software and the results recording, etc. So people can have different tasks that they learn to do well, or they can all share those tasks. But if you anticipate testing large groups of individuals, plan on training this at least 4 to 6 people. And again, this is where you might want to be giving our office a call just to talk through so we know which direction you're going and we can help and support you. All right, then on the next page, there are 2 important, or lower down on the application, there are two important things I want you to be aware of. The CLIA waiver, almost all of you, I'm sure you're not independent laboratories at this time, so you are going to use the CDPH antigen testing CLIA number and ordering physician. All right, you're going to choose that option. You would only not choose this option if you are already a laboratory or a verified deputized testing site that has a CLIA number or a CLIA waiver. So if you are not one of those things, and I don't think any of you are, then please choose the yes option. We're going to use the CDPH CLIA number. And then most of you probably do not have a stash of Binax Now test kits, so you will be using the state's Binax Now test kits. That is the correct option in that box. And in this last option here, you are, almost all of you, I think, not already established partners with somebody who's doing PCR testing for you. So your choice in this matter is going to be no. I do not have a partner for PCR testing. I will be partnering with the Valencia branch lab. That's what VBL stands for. So I have indicated the proper drop-down menu choices here for you as you go through the application process. Now, I want to go back to this first box just to be sure that you're consistent when you put in who is the lead person and what is the corresponding work associated email for that individual and their cell phone number. It's very important that those things all match, that this refers to one person who will be the initial account administrator according to the Primary Health Platform program. So I just want to remind you to be very clear and to not put different names and emails in here that don't match up properly. So that was actually as far as I was able to get in the application before today's meeting. I think that is most of it. And then it takes you on to the MOU, which is, I think it's a 3 or 4 page document. It's not very lengthy. It's quite straightforward. in that MOU, you are agreeing to join in a partnership with the California Department of Public Health. You are signing this agreement to indicate that you agree to comply with the requirements of the testing program and that you will properly manage the protected health information that you may have access to. So this does involve HIPAA protected health information, obviously, since we're talking about getting names and birth dates and medical health information and test results. That is, by its nature, HIPAA protected information. So those of you who are going to be managing and doing these tests will be doing a short HIPAA training video as part of your training process going through primary. You are welcome to view those videos in advance. I believe they are available on the open resource page at the Primary Health website, and that is the resource page that I showed you earlier today. You are also signing the agreement to indicate that when someone's Binax Now rapid test is positive, you agree to do a follow-up confirmatory PCR and to send that PCR test swab to the Valencia branch lab. This is part of the process where Marin County Public Health and Randy's team going to be trying to really lean in a bit and support you to ensure that you feel very comfortable with that part of the process, and that we try to ensure that those tests can be couriered or otherwise delivered to the right place at the right time. There is a network of drop boxes where you can put these PCR test specimens in to be sent directly to the Valencia branch lab. But of course, that drop box is over in the San Rafael area and not in West Marin or North Marin, where many of our community-based organizations are. So we are aware of that, and we will try to support you in that process. But as part of the MOU that you are signing, you are agreeing to do the follow-up PCR and to put that information into the Primary Health IT platform and to send that specimen to the Valencia branch lab. And you are agreeing in that MOU, because it has not been updated for this specific process, you are agreeing to receive or be responsible for any fees associated with that PCR. Please do not be intimidated or let that prevent you from signing the MOU, because the county and the state will protect our CBOs from ever being billed or required to pay for a client's PCR in the instance that they are without medical insurance or support. So it is part of the MOU process. However, be advised that we will ensure, and I'm working with CDPH right now to try and clarify how that will happen, but to avoid any charges for the PCR testing that will be done. The Binax testing, the rapid testing, is free end to end, so there's no worry there, and that is true at least through the end of the year. And we hope that the supply increases on those tests, because it has been dropping a little bit lately because of all the testing that we're doing as a result of the surge and the variant that is present in our community. All right. So that's a lot about the application process and some critical information about the MOU. And as an overview to kind of, well, we're investing a lot of time here to get this program up and running. What is it that CDPH is providing for us? What is it that Primary is actually doing through this platform? CDPH is providing these resources specifically, and Marin County is really supporting you in this space as well. And then the IT platform is allowing you to do the testing and also the proper laboratory result reporting that would be required to do any kind of medical test of this type. So they're providing an account management support person, as well as a help center, and regular office hours are available for you to troubleshoot any issues you're having with your account. What do the supplies and materials look like? I think by now, or I hope most of you may have seen an Abbott Binax Now Rapid Antigen Test card. This is what the card looks like. This is what the PCR kit looks like. So if this pink card, if the test result is positive, then you will be required to first repeat this test and also obtain a second swab, which goes into this little vial off and then is mailed. Here's the little mailer that goes off to the Valencia branch lab. The virtual training and the on-site training that you do will ensure that you are very comfortable with the process of how to do this test, the rapid test, and how to do the PCR test in a safe way. Now, many people ask me, oh my gosh, Lael, what happens? I've just tested someone and it turns positive, and now I'm standing there, usually outside, saying to myself, goodness gracious, I just stood there while this person swabbed their nose and I did their test for them, and I was exposed to COVID while I was doing that. By nature of this testing, it will happen that at some point you may test someone who's positive. So let me reassure you that we are going to make everyone comfortable with the proper personal protective equipment, the PPE that you will be using. You will have a well-fitted N95 on, you will have eye protection on, you will have gloves on. It has been my experience since March of 2020, since doing testing on individuals, many of whom were positive. Not a single one of my testing team ever contracted COVID from doing a COVID test. You may think that's odd and unusual, but it isn't, because when we are preparing to do the testing, we are protecting ourselves to the maximum extent possible. So when you're testing, you are being very careful, you're highly aware, you have the proper PPE on, you're spending only a very limited amount of time with that individual who is going to be masked immediately before and immediately after the swabbing is performed by the individual themselves. You will be handling the specimen, Q-tip, the swab, and then you will be changing your gloves and performing hand hygiene in the proper way. And you are not going to get COVID if you do all of those things. You are much more likely to get COVID by forgetting to wear your mask in the grocery store or the movie theater or the bar or the restaurant. So I'd like to reassure everyone on that point. At one of our future webinars, we will discuss safety techniques and PPE. So here again, the PCR has to be done following the positive antigen test. And you're going to be using these color PCR test kits that I just showed you. We are working on the fee part of it so that bills do not go to the CBOs if for some reason you get up and running right away and we haven't sorted all the paperwork out, and you've done a positive test and you've sent out the PCR, and suddenly you have at your doorstep a $55 bill from the Valencia branch lab for having performed the PCR test that you sent them. You are going to get immediately in touch with my team, and we are going to figure out how to take care of that. So back to the resources page, which I showed you previously. This page has a lot of drop-down menus on it. It has links to handouts, the playbook, some pages where there are videos, some discussions about the training. I have to say, I'm impressed that in the last 4 weeks, Primary Health has improved the structure and transparency of being able to navigate to their resources. But they are a new platform, and I see this as one of their weaker areas right now, is the resources and the available videos are not sufficient, I think, yet. Once again, this is one area where my team and my testing team, expert swabber people, will be able to support you with additional training and Q&A as may be needed, so that you are finding what you need if you're not getting it through the primary website, with the assistance of your account manager at the Primary Health IT platform. So back to the quick overview. As you're enrolling in the program, you're going to always be choosing the option for the non-school program. Unless you're a school, then if you are, you need to call us. And you're going to be focusing on wherever it says antigen testing or antigen testing with confirmatory PCR. That is the program that you're enrolling in. Today, we're at number 1 right here, learning about the testing operations and options and the program itself. You guys are going to then do the application as has been described on today's webinar. You will progress through to sign the MOU. After your application is received and approved, you will get an opportunity to sign that MOU. I have mentioned some things to be aware of. What you are signing on to do and what your responsibilities are spelled out very plainly in the MOU. And again, please do not be intimidated by the potential financial burden that may come from doing PCR tests. We will protect you from that. And once that MOU has been reviewed and approved by the California Department of Public Health, California Department of Public Health will contact the Primary IT platform, who will then set up an account and email you to begin doing the further account setup that is required by adding information about the team, the testers, and other entities that you're going to be working with to create your testing team. And as you do that, then you're getting ready to proceed to this is creating your organization's profile. So that's setting up your account. You can read through this on the FAQ sheet, on the handout. And then once you do that, you'll be going through the training process, and then you'll be doing the required training, the attestation, and the certification. And then number 7, finally, you get to begin testing, but only when you feel ready and not before that time. So our team is here at COVID-19 Test Support at marincounty.org. That email is going to come to Matthew Casey, but Randy Lecter and Patty Lyons and myself will have access to that, as well as other members of my testing team, to make sure that any questions you have get answered. If you're not sure where to go or even where your question should go, you may use that email to get through to one of us. I think this is, I'm going to have to check this CD lead telephone number. I don't know if Marcia's on or not, but I just want to verify that.
I am here.
Yeah.
I don't believe that is the correct number for CD lead.
Okay.
I'll double check and let you know in the chat.
Okay, we'll fill that in. So that's when you have a positive test, you're going to be calling this number always to report the positive test. So immediately when you find a positive test, you're immediately not alone, because you're going to be immediately calling public health. You're going to be providing information on that test result. And then if you need further resources or support at that point, that person can direct you over to the testing team, over to my office. Ongoing support from Primary Health, you'll have access to regular office hours where you can sign up and you get face-to-face time on a Zoom call with an account support person who can help you to understand and troubleshoot issues with account management or answer questions about testing. And then in further webinars, we're going to talk about the logistics of testing. We're going to do a walkthrough of what it looks like to do a test. And we'll also talk about more about safety, as I mentioned, and more about PPE. And we'll get into all the other fun stuff on our next webinars. So now I would like to finish for today with my presentation. And I would like to take any questions. And then we'll also have an opportunity to hear from the experiences of some individuals in your group who are down the road with this process, maybe already in the training part of it, or even potentially getting ready to embark upon their first testing events. So I'll stop sharing now, and we'll put that email in the chat, and we can I'll turn it back over to Randy for moderating the discussion and ensuring that any questions in the chat get answered. and also for inviting Paul or others to talk about their experience so far.
Great, thank you. That was that was a great overview, and thank you so much for taking the time to, because we'll provide these slides, so then you all can use it kind of as a checklist that you're going through, so you'll know what to select when you're going through the application process. And the idea is to make that easier for you all. And thanks to especially our folks out in West Marin who helped us identify, some hiccups and said, it would be really helpful if people knew exactly how to answer the questions in the application to help facilitate that. So thank you for that. That's going to be a great resource. I do want to mention that the email COVID-19 test support at marincounty.org is not quite live yet. So if you start emailing it today, probably you'll get an error. So maybe you can give that till Monday to before you start sending messages. If in the meantime you have questions, feel free. I think you probably all have my email because I sent the reminder out. But we would like to centralize the questions that come in by using that email address when it's live. So I also would like to cover a few of the questions that were put in the chat. This, Shireen asked a really great question. This came up actually this morning in a meeting with the West Marin community group. And I think that the CBOs will want some guidance about putting together, I like how you word this, a testing plan about who will be tested, how frequently and under what circumstances, because there are capacity issues, right? There's staffing issues. So are they going to test all comers, anybody who, wants, a test at any time of day? Or is it people who are experiencing symptoms? Is it for outbreaks? And so I don't know if that's a requirement that CDPH has or what the recommendation is at this time for that.
So this is one area where county is going to be advising them to help them figure out what is the right fit for setting up their testing program. And they will work with you, Randy and Patty, on some of the messaging maybe, or with us to determine how to message that to their community to manage the expectations of the individuals who might, you might be at risk of having people overuse your testing services. And so we don't want you to get into a situation where you're overwhelmed and we really just have to shut it down because you've got masses of people lining out your door every third Tuesday. We want you to set up something that's going to be the right size for you and also be the highest benefit, for the county in terms of either surveilling or providing a service to the populations that we are interested in supporting. So you don't have to make that decision on your own. We are definitely here to help you with that.
Great, thank you for that. We have two questions about people interested in the training and certification, if not affiliated with a specific testing site, or is the training available prior to applying for the program?
The training comes with the program as you apply to the program. And once your account is set up, then in order to begin testing, you're required to go through the training process, which is a series of videos. And then it's my understanding, I haven't done it myself, but it's my understanding that it is a real-time but virtual assessment of your ability to do the testing process and to use the platform. So I don't know exactly what that looks like because I haven't been on that end of it. If you want to do some practicing beforehand, we would like to be able to support that. I don't know if I will have the staffing capability to do that, but we would like to do that. And if you feel that you need additional training or you would like oversight for your first testing day or days, then we would also like to support you in that as well, staffing dependent. So I only have a certain number of staff. So if you all jump on board at the same time and then you say, oh my gosh, everybody, can we all start next Monday? The answer will be no. But if we can schedule some site visits where we can do PPE guidance and help everybody understand how to do an N95 seal check and make sure that everyone is comfortable with and they're using the Binax cards properly, then we would like to be doing that to the extent that we are able. So if the Delta variant truly has plateaued and starts to wane and we get some bandwidth in my team for doing more field work in this way, then we would very much like to be doing site visits with you as you get ready to be doing your testing. That goes without question. I don't want anyone to open up and start doing testing if they don't feel absolutely secure and ready to do that. And quite honestly, it's hard for me to imagine opening up and getting started without feeling that way.
Great, thank you. I think that's a great, it'd be great to hear from Paul Russell with North Marin Community Services, because he may be the only one sitting on the screen who has been through the training. So if you can just share 2 minutes worth of what that was like and a little bit more of your insights, that would be great.
Sure, thank you, Randy. So I think the very first thing I want to do is echo what we heard earlier, which is don't be overwhelmed. When you start to get the packets, there's not just one manual, there's 2 manuals. That seems repetitive. It can feel overwhelming, but once you sort of sit down and start to put your hands around it, it becomes very clear, and it's actually a very simple program once you're up and going. On the application, a couple notes that I would put out from when we were going through is just note that, so for instance, I'm the lead for us and the site lead. So in the application, my name, my contact information went in and it automatically filled to the MOU. But as an organization, all of our MOUs are signed by the CEO, which was fine. When we got the MOU, we just changed it over. It didn't automatically make her the site lead. That was okay. So it'll autofill, but you can ignore that. Still make sure that the site lead is who goes in the application. And also, for where you have your email and your phone, at some point, every time you log into Primary, it's going to have a multi-factor authorization. You don't have a password to log into Primary. You get a code, and that code comes to you either through your email address or your phone. Because I put in a work phone, a desk phone, I have to use my email now to log in, which is fine. I get a code and I log in. If you're someone who really wants that to be more portable and go to you as a text message, put your cell phone in the application as opposed to a landline. So I would note that. I'll do a quick show and tell because we are active. We've done our training. We have the test kits and we've been doing tests. And unfortunately, my camera is not going to really show very well, but I've got this big box that we purchased to hold everything because really we don't have a dedicated space to test. I might need to go to a corner office or out, to the backyard where we have a table or in the front. So I needed everything to be portable. So just to, hold on, let me get rid of my effects. That's the problem. And hopefully, okay. Sorry about that. So I've got a binder that has the manuals in there. I have to attest that my site people have been trained. So I keep that in the binder. So I've got everything organized here. We do have fact sheets in there as well. So people who are getting the test want sort of the medical fact sheet, that's available for us to give. But then more importantly, in the box, I keep my gloves. I keep the hand sanitizer, because people want to sanitize their hands before. I keep the unused cards and the swabs are all in this box. And lastly, I also keep several, not all of my PCR tests, but several of my confirmatory PCR tests here. And you can see one of them, thanks to Matthew and the county, I was able to get some biohazard bags because that was one thing that we were short on. For our own program, we have gloves, we have N95 masks, I have face shields, so I've got the PPE. But what I didn't have were the biohazard bags. So again, the county was very responsive and got those to me quickly. So if I have a positive test, I have to discard that in this process. And I keep all of that in this little case that I can just walk around and do tests and restock it, once a week or so if necessary. So far, it has been used for staff who have been traveling and need to do that test after 5 days coming back so that they can be comfortable coming back on site. Because we have limited bandwidth, we don't see ourselves doing a big public outreach with it. Our program will be centered on staff, on client referrals. So if we have a case management client who needs a test in order to get into a program, in order to travel, et cetera, we'll provide that for them. And we also have child development programs on site, after school programs and preschool programs. And actually, I'll say we can't use it on the preschool program because I believe it's 5 and up. So we can use it with our after school programs and those students if we had an exposure or an outbreak.
Great.
But I will
Paul?
just say real quick that so far I've had to access the state health, the account rep, the primary account, and the county, and all 3 entities have been quick to respond. When I've had a question, I get an answer and I get support. So I really appreciate that.
Great. I'm looking at the clock and it's so helpful. And I'm sure that people who have questions might be able, well, we could see if they would be able to reach out to you to ask you a little bit more. I know, Michelle, we're out of time, but if you wouldn't mind popping a few of your thoughts into the chat so people can see that, that would be
Yeah, no
wonderful.
worries at all.
And then it'll be reflected in the recording as well.
Sure.
And then Paul, just I'm going to hand it over to Cicely actually to close the meeting. But Paul, how long did the training take you?
The Zoom training, the in-person was about 50 minutes. And then as a site lead, I probably invested another 2 hours in terms of going through the materials, organizing my binders, watching the additional videos, etc. But the training for like how to swab and run the test and do the online, that was only an hour.
Okay. So where does the 9 to 10 hour estimate come from?
Oh, the 9 to 10? No. 1 to 2 hours.
Oh, I had heard. Okay.
1 to 2
Okay,
hours to
great.
go through the binders and all the materials and to make my binder, to take the electronic forms and make
Okay.
the records.
All right. I think that's helpful. Great. Thank you. And given that we're at time, I'll hand it over to Cicely for a quick close.
Yeah, I just want to let you guys know that, we're here to support you, as Lael said, and that just so you know, we have operations every day of the week, 5 days a week. We have a nurse that's assigned processing lead cases. We have a robust contact investigation team. So in the event that you do have some positives, you can directly reach out to us in real time, and we have phone numbers that are answered. And I put those phone numbers in the chat. So just rest assured, the health department we also have resource programs for people who need to isolate and get food, which I'm sure some of you guys are familiar with. So just so you know that, our response operations are really strong at this point. And I think the other thing is just, I don't know if Lael mentioned this, you probably did, but you just want to get in line because Binax is in high demand, right? So get in line and get your Binax. If you want to do it, go for it. And I hope that you guys, pursue this, and we're here for you if you need us.
Great. Thank you. And Michelle, if people want to take a peek at the thoughts that Michelle, you can wave to us from San Geronimo, because they're in the middle of the process. They haven't yet done the training, but they went through the application and have some good learnings from that. So with that, we're just 1 minute behind. We'll make sure we make this recording available. And of course, you, I think, hopefully know how to ask questions and know that we're here to help get this off the ground. So thanks everybody for taking the time, and special thanks to Dr. Duncan for her presentation.
Yeah, my pleasure. And we'll include some notes and try to get everything out to you by the end of the week. And Rennie, we should look at a week or less for our next webinar just to help the process move along, but I'll defer to you and Cicely on that.
Okay, great. Thanks everyone. Enjoy the rest of your afternoon.